I absolutely love my job.
I love my job.
My name is Robin. I am a Reimbursement Access Director, and my role in this position is I assist patients and their caregivers and their prescribers for patients to access RUCONEST.
For a patient's initial training, I don't really have a time limit. I think it comes down to the patient. It comes down to their familiarity with HAE. For some patients, it can be a lot at once too. So if that's the case, we'll talk about a time that I can come back and we can kind of have part 2 of education and training.
When I am getting ready to meet with a patient, I'm going to find out what some of their concerns are, what they're worried about, because until I can address those concerns and worries, I'm not going to be able to have them move forward as easily in their training.
She had me talk about even the last 10 years prior to the diagnosis. Like, she found out about my kids, my grandson, my life, what I do.
She was so patient. I think that's the biggest word for you, was the patience and the level of education she had. I mean, like, it definitely made me feel more confident in moving forward with my diagnosis and knowing that I have support with Jan, with RUCONEST, and it's been great.
Assistance from an RPA, the RUCONEST Patient Advocate, is an ongoing thing because people's needs change over time.
Having them know the full scope of the resources available to them is very important so they don't feel like they're all alone.
The assistance that I've received from my RUCONEST team has just been above and beyond. It really gives me the confidence to know that I'm going to get the help that I need when I need it.
You know, so I could get back to my life and I could get back to what mattered.
Being able to help them learn how to manage their condition is extremely important and very rewarding.
Prior to using RUCONEST and having that, I was in the hospital quite frequently with swelling. I can say I haven't been in the hospital in the past year.
If I have to be on camera, I'm not worried about it. If I want to go to my daughter's ball game, I'm not worried about the heat triggering. So being able to self-administer now, that has been a game changer for me.
RUCONEST is an injectable prescription medicine that is used to treat acute attacks of hereditary angioedema, also known as HAE, in adult and adolescent patients over the age of 12. Important safety information. Do not use RUCONEST if you have experienced life-threatening, immediate hypersensitivity reactions, including anaphylaxis, to RUCONEST or to any other C1 esterase inhibitor product. Call your healthcare professional or the emergency department right away if you experience wheezing, difficulty breathing, chest tightness, lips and gums turning blue, fast heartbeat, swelling, faintness, rash, or hives. Do not use RUCONEST if you have a known or suspected allergy to rabbits or rabbit-derived products. If you do not have a known rabbit allergy, testing is not required. Tell your healthcare provider about all your medical conditions, including if you have a known allergy to rabbits. Tell your healthcare provider about any other medications you are taking, as some medications, such as birth control pills and certain androgens, can increase risk of clotting problems. Also tell your healthcare provider if you are pregnant, breastfeeding, or planning to do so. The most common side effects patients experience during clinical studies include headache, nausea, and diarrhea. These are not all the possible side effects of RUCONEST. If any of the side effects get serious, or if you notice any side effects not listed here, please inform your healthcare provider or pharmacist. You can also report side effects to the FDA at 1-800-FDA-1088 or visit www.fda.gov/medwatch. For product information, please contact Pharming US toll-free at 844-474-2764. For adverse events, product complaint reports, and medical information, please call 800-930-5221. Please visit www.ruconest.com for full prescribing information, including patient product information.